Hi everyone, in this video we'll solve CPC exam practice questions based on Pathology and Laboratory chapter. Let's start. Read the question. A patient with severe asthma exacerbation has been admitted. The admitting physician orders a blood gas for oxygen saturation only. The admitting physician performs the arterial puncture drawing blood for a blood gas reading on oxygen saturation only. The physician draws it again in an hour to measure how much oxygen the blood is carrying. Select the codes for reporting this service. When you look at the options, you can see in option A and option C, they have appended modifier 51. But these codes are lab and pathology codes. So we should not use modifier 51 with pathology and laboratory chapter codes. So directly eliminate option A and C. Now check the codes in option B and option D, that is 82810 and 82805. Option B 82810 is for gases blood O2 saturation only by direct measurement except pulse oximetry, and 82805 is for gases blood any combination of pH, PCO2, PO2, CO2, HCO3 with O2 saturation. But in the scenario they have given blood gas for oxygen saturation only. So we have to use the code 82810. So 82805 is wrong, and along with 82805 they have appended modifier 90 which is for reference outside laboratory. But in the scenario they have not mentioned reference outside laboratory, right? So we cannot append 90 modifier, so eliminate option D. We are left with option B which is the right answer. They have appended modifier 91 in option B because that is for repeat clinical diagnostic laboratory test. In the scenario you can see the physician draws it again in an hour. Okay, so it is a repeat clinical diagnostic laboratory test. So we are appending modifier 91. The right answer is option B. Next question. Read the question. This patient presents to the clinic lab for a prothrombin time measurement because of long-term use of Coumadin. Choose the correct CPT and ICD-10-CM codes. Let us check the first codes from each option. Check option A and B first code 85210, that is for clotting factor 2 prothrombin specific, and in option C 85610 is for prothrombin time and 85230 is for clotting factor 7 pro-converting stable factor. So which among these is the right code? If you selected 85610, then you're absolutely right, because the code 85610 is for prothrombin time. In the scenario, they have mentioned prothrombin time measurement. So option C is the right answer. We'll eliminate all other options because 85210 is for clotting factor 2 prothrombin specific. So that is not matching with the question. Directly eliminate option A and B, and option D 85230 is for clotting factor pro-converting stable factor. So that is also not mentioned in the question. So eliminate option D. In option C, they have mentioned ICD code Z79.01 because that is for long-term use of anticoagulants or blood thinners. Coumadin is a blood thinner, so they have used the code Z79.01 for long-term use. Let us move on to the next question. To watch the video on guidelines and some more practice questions, check my playlist CPC Exam Pathology and Laboratory series. And also don't forget to show your support to my channel by liking, sharing and subscribing to CodeMed Mastery. Read this question. You can pause the video and try to solve it by yourself. A surgeon performs a cholecystectomy for a patient with cholecystitis. The removed organ is sent to pathologist for gross and microscopic examination. What CPT code is reported for the surgical pathologist service of examining and reporting on the specimen? So in this question, surgeon is performing cholecystectomy and the removed organ is sent to the pathologist for gross and microscopic examination. So they are asking which CPT code is reported for the surgical pathologist service. So what is cholecystectomy? It is removal of gallbladder. Let us look at the options. Check option A 88307. That is for level 5 surgical pathology gross and microscopic examination. So below that they have given the names of the specimens. Check whether gallbladder is mentioned in the specimens. Below 88307. They have not mentioned gallbladder. So eliminate option A. And coming to option B, 88302. 88302 is for level 2 surgical pathology gross and microscopic examination. Below that code also they have not mentioned gallbladder. Right. So we cannot use 88302. Eliminate option B. Coming to option C 88304, check the code, that is for level 3 surgical pathology gross and microscopic examination. In that you can find the specimen gallbladder. Right. So we are using the code 88304. Option C is the right answer. And eliminate option D because that is for surgical pathology gross examination only. So it will be wrong. In the scenario, there is gross and microscopic examination. So eliminate option D. So while coding surgical pathology codes, we have to check on what specimen the examination is performed. Next question. A patient had a semi-quantitative urinalysis for infectious agent detection. Choose the appropriate code. Check option A 81050, that is for volume measurement for time collection each. Option B 81005, that is for urinalysis, qualitative or semi-quantitative except immunoassays, and 81099 is for unlisted urinalysis procedure. And in option D 81005 is for urinalysis. We already checked it. And 83518 is for immunoassay for analyte other than infectious agent, qualitative or semi-quantitative single step method. Now I'll highlight the main term in the question, that is semi-quantitative urinalysis for infectious agent detection. So which among these is the right code? The right code is 81005 because that is for urinalysis, qualitative or semi-quantitative except immunoassays. So it is matching with the scenario. The right answer is option B. Okay, we'll eliminate option A because that is for volume measurement for time collection. In the scenario, they have not mentioned anything as such. So eliminate option A. We'll eliminate option C 81099 because that is for unlisted urinalysis procedure. That is wrong. And option D 81005 is the right code. But along with that, they have mentioned 83518, that is for immunoassay for analyte other than infectious agent, qualitative or semi-quantitative. So it is not matching with the scenario. So eliminate option D. Because if one code is wrong, the entire option will be wrong. Our right answer is option B. Read the question. A patient presents to the ER with crushing chest pain radiating down the left arm and up under the chin. There are elevated ST segments on EKG. The cardiologist orders 3 serial CPK enzyme levels with instructions that the tests are also to be performed with isoenzymes when the initial tests are elevated for that date of service. The CPK enzyme levels were elevated, therefore the lab codes would be. In option A, B, C and D, you can see they have given 3 codes, that is 82550, 82552 and 82554. 82550 is for creatine kinase CPK total. In the scenario, you can see they have given CPK enzyme. So 82550 is the right code. And 82552 is for isoenzymes. You can check in the question, they have given the tests are also to be performed with isoenzymes. So 82552 is also the right code. 82554 is for isoforms. In the scenario, they have not mentioned isoforms. Right. So 82554 will be wrong. By this, you can eliminate option D. In the scenario, they have mentioned the physician orders 3 serial CPK enzyme levels. And they have mentioned the tests are also to be performed with isoenzymes when the initial tests are elevated for that date of service. So here the tests are repeated because the physician orders a series of 3, right? So the lab tests are repeated. So we have to use the modifier 91, that is for repeat clinical diagnostic laboratory test. In option A, modifier 91 is not appended. So we can eliminate option A directly. Modifier 76 will be wrong because that is for repeat procedure or service by same physician or other qualified healthcare professional. But in this scenario, there is repeat clinical diagnostic laboratory test, right? So we cannot use modifier 76. So option A will be wrong. Now we are left with option B and option C. Now let us see how to code. So here there are 3 serial CPK enzyme tests. So the code 82550 is for CPK enzyme level test. Here there are 3 serial CPK. So for the first one we are using 82550 and the second and third CPK test is reported with 2 units of 82550, okay, with modifier 91. This is how you have to code when they have given multiple number of tests. In the scenario, the physician orders the test with instruction that the tests are also to be performed with isoenzymes when the initial tests are elevated. And here you can see the CPK enzyme levels were elevated. So they have to test for CPK isoenzymes as well. So here there will be 3 isoenzymes test. So how you will report it? 82552 for the initial test and the remaining 2 units 82552 with modifier 91. So option C is the right answer. Option B will be wrong because they have mentioned 82550 only once, but you have to append modifier 91 for the remaining 2 units. So eliminate option B. Next question. This is a case study question. In this they have mentioned tissue submitted gallbladder. The specimen is received in formalin in a container labeled gallbladder. So here they have mentioned gross description and microscopic description. And the specimen is gallbladder. So check option A 88304, which is for level 3 surgical pathology gross and microscopic examination. In that, among the different specimens given, you can find gallbladder, right? And the code is for gross and microscopic examination, which is mentioned in the description of this procedure. So 88304 is the right answer. Let us check why other options are wrong. Option B 88329 is for pathology consultation during surgery. In this scenario, anywhere they have not mentioned pathology consultation, right? So eliminate option B. And option C 88348 is for electron microscopy diagnostic. In the scenario, they have not performed electron microscopy. So directly eliminate option C, and option D 88333 is for cytologic examination, that is for pathology consultation, cytologic examination, touch prep, squash prep, initial site. It is not matching with the scenario, so eliminate option D. Option A is the right answer.